Next up is Michael O'Driscoll. Michael O'Driscoll is the Director of Health and Emergency Management for Gila County, Arizona. Mr. O'Driscoll joined Gila County in 2011 and has more than 30 years experience in environmental health, emergency management, and public health emergency preparedness. He graduated with a Bachelor of Science in 1987 from Northern Illinois University and completed his Master of Public Health at Concordia University in Lincoln, Nebraska. Mr. Driscoll began his public service career at the Santa Clara County Environmental Health Department in 1989. He received his Registered Sanitarian license in 1990 and progressively rose through the ranks. Additionally, he gained extensive experience working in the environmental health programs at both DuPage and Kane counties in Illinois. Mr. Driscoll spearheaded Gila County's community response to the COVID-19 pandemic, beginning in 2020. By coordinating contact tracing efforts, as well as creating and implementing streamlined vaccination protocols. These efforts led Gila County to become the first local health department in the United States to begin vaccinating general population residents. During the COVID-19 pandemic response and vaccination efforts, Mr. O'Driscoll also led his emergency management team, responding to the 5th, 6th, and 11th largest wildfires in the state of Arizona's history. Assisting in the response to COVID-19, large wildfires, and post-fire flooding, the Gila County Environmental Health staff played an integral part in protecting the health and safety of Gila County residents.
Great. Thank you for that introduction. And to all my fellow sanitarians, welcome to the annual conference here. And what I'd like to do is just go over briefly how Gila County handled the COVID response hand in hand with our environmental health staff. In particular, exactly, and I'm sure many of you went through this during COVID, what we asked of our sanitarians, which was difficult, and what we sent them out to go to the businesses and ask them to do was very difficult. And then I'd also like to throw in there some of the wildfires and flood response that our environmental sanitarians helped out with. So I'll go ahead and get started. So if we can go to the next slide, please, that'd be great. So a quick bio on me again. I know we just went over that, but a really quick bio is I started my career back in California in the Silicon Valley, Santa Clara County, environmental health, and then I moved back to Illinois and worked for DuPage County and Kane County. And many of you older sanitarians remember the FDA rep out in the Western region called John Marcello. The EH world is fairly small. So John Marcello was actually the trainer in DuPage County when I first went to go work for them. So it was very nice to come out to Arizona in 2011 and meet up with John Marcello again. He's a super good guy. And then in 2011, when I accepted this position, of course, we had environmental health under the health department. We also had the clinic operations such as immunizations, vaccinations. I also handle animal control, emergency management, public health emergency preparedness, which deals with disease investigations, and WIC. So, and then during COVID, the county management made a decision to place the on-site wastewater program underneath environmental health as well. So we do all sorts of programs in our rural county. And what happens in some of the rural counties is we have a lot of crossover, and that becomes important for what I'm about to go into for the rest of my presentation. The crossover that our environmental health staff made to help out with the COVID response and fires and post-fire flooding was extremely important in our success in Gila County. And so since January 2020, this is sort of, I'm going to run down sort of what Gila County has dealt with since January 2020. And we're talking, it's close to 2 years now. In January 2020, we all know the COVID pandemic started. In February 2020, what happened was Governor Ducey started coming out with a whole bunch of executive orders, and they kept being released fast and furious. And many of those executive orders basically told the health departments what they had to do. Because in Arizona, we all know that public health is run by the state health department. However, some of the responsibilities are delegated in our delegation agreement to the counties. During a public health emergency, a declared public health emergency, basically every county is responsible for executing the orders that come from the governor's office as well as the state health department director. So in February, we started coming out with these executive orders, and many of those included the guidance on restaurants, bars, and theaters, all of the facilities that we license through our environmental health program, and whether some of these places could actually open, or some of these places can open with 50% capacity, those kinds of things. And then in June 2020, in Gila County, we started seeing the COVID virus double in positivity cases, and our local hospital ICU beds were filling up very quickly. And we have two hospitals in Gila County, one in Payson, Banner Payson, one in South in Globe, and that's Cobra Valley. Both of those hospitals, all of their ICU beds were full. And we also were in short supply of ventilators for some of the positive COVID patients in these hospitals. So we had to worry about that. And then right at the exact same time, in June 13th, the bushfire started in Maricopa County, but it started on the border of Maricopa County and Gila County, and it moved very fastly into Gila County and burned close to 200,000 acres. And it caused massive evacuations in Gila County communities. It eventually, the bushfire became the 5th largest wildfire in Arizona history. And what we had to do is I had to actually take several of my emergency management staff that were helping with the COVID response and put them on the evacuations for the bushfire. So very quickly, Gila County became stressed as far as resources, what we can and can't use as far as personnel. So we were struggling there. And then just a few short months after June of 2020, we actually had to start the COVID vaccines. We received our first shipment of Moderna vaccine right before Christmas. And right after Christmas is when we had to organize and do some large mass vaccination clinics for the COVID vaccine. Most rural counties like Gila received the Moderna vaccine, which was much easier to handle than the Pfizer vaccine. So then you fast forward from December into June, as we're still doing the vaccines in Gila County and getting those out, we had the telegraph fire started, which eventually burned about 150,000 acres, and again causing massive evacuations in Globe and Miami. Eventually, the telegraph fire was the 9th largest fire in Arizona history. So again, another large forest fire. And then right after that fire, the telegraph fire, in Arizona, many of you know, we get about a nanosecond in between forest fires and monsoons. And what happened in this particular case with the telegraph fires, we got probably about a 2-day break in between the large forest fire. And then a couple monsoons came into Gila County and parked right over the massive scars, the burn scars, where the telegraph fire happened in the Pinal Mountains, and it caused massive flooding in Globe. And we had some homes destroyed. We had some large scale flooding going on in some of the drainage areas. So we had to deal with that. And then about 5 weeks later, we also had some more flooding, massive flooding in Miami. Many of these pictures and videos were posted on Facebook for the world to see. And the pictures and the videos were quite accurate. Downtown Miami was basically underwater. We had more large-scale property damage, and we also had a lot of homes that were destroyed because of this flooding as well. And then just when we thought we were done with the flooding, on August 18th, a week later, we had another monsoon park above the burn scar area. And then this particular flooding that happened almost flooded the local hospital, which would have been a challenging situation to evacuate a hospital. And then right at the end of August, we had the Delta variant. So we had this third wave of the COVID, especially in schools. We had the ICU beds again filling up in August in our hospitals. And then we had the monsoons that were basically close to causing an evacuation of the local hospital. So there was a lot going on in Gila County, and a lot going on in Gila County Environmental Health Department as far as what they were helping with. And so, so a couple of the keys to the successes that I see we had through the COVID crisis, the fires, the floodings, the post-fire flooding response, all that the question I kept asking was how did we become the first county in the country to move to vaccinating the general population while responding to the massive forest fires, evacuation, sheltering, flooding, and post-fire flooding damage? And I honestly did not know we were the first county to move into vaccinating the general population until CNN called. And they called with a request. They wanted to send a team of their reporters out the globe to interview our entire team. And it's interesting because when you sit back and you look back on your successes and some of the failures and what you can and can't do better, sometimes you get wrapped up in the response. You get so wrapped up in the response that you don't take time to reflect on the successes. So typically during the response, your focus is always on the things that are going sideways and how to fix those, because that's what everybody is dealing with. Is this group needs this, that group needs that, these homeowners need this, we have evacuations, we need sheltering, we have environmental disasters going on. So you're always trying to fix those things going sideways. And sometimes you don't focus on all the successes you have. So when you fix something, you fix an environmental issue, you move on to the next problem to solve that. And you really don't have time to reflect on that until you get a little bit of time. And we haven't had time in 2 years to reflect on that until very recently. So when CNN called, it was a nice reminder to all of our staff that we had accomplished some pretty incredible things. However, the funny thing is when CNN called, when they called me, I didn't return the call to the next day because I thought it was a crank call. And this is pretty much how my conversation with CNN went when I called them back. They're like, Mr. O'Driscoll, we'd like to send a team out the globe to do a story on how Gila County became the first county in the country to move in the general population for COVID vaccinations. And I literally told them that I don't think we're the first county to do so. And they said, yeah, you are. And I said, and I actually told this to their producer. I said, are you sure it's not fake news? And with a serious voice, their producer said, it is not fake news. And I said, are you really sure about that? And they said, we are. And I said, sure, come on out the globe. And I really didn't believe that this was true, that they would actually send a production team with reporters out to Gila County. And they said, well, we're going to send somebody tomorrow at 10 o'clock. I said, sure, come along, send them. And sure enough, what happened was they actually did send out some reporters. And after we got on CNN, then we had a whole bunch of other local media and national media call. So for about 2 weeks, it was nice to see the success of the hard work of our staff pay off. And our staff received a lot of accolades in the media, nationally, as well as locally for some of the successes. So I was happy to see that. And I was also happy that that was not a crank call. So, so here's the strategy we used through the pandemics, forest fires, evacuations, flooding, and flood recovery. We used what everyone is familiar with. Most environmental health department employees are plugged into the incident command system. In the health department, they call it the HEOC. In emergency management, they just call it the EOC, the Health Emergency Operations Center, or just the Emergency Operations Center. In Gila County, about 10 years ago, I combined FEP and EM. So we just call it the HEOC for any kind of an event that happens. So if you're familiar with the incident command system, this is a really, really good system to use to expand a response and contract a response depending on the size of the response. And what we learned during COVID was our HEOC org chart kept expanding. Well, I apologize for that noise. Someone's at the front door. So the HEOC chart kept expanding, but here's what we started out with. We started plugging in everybody into the finance, logistics, operation, or planning for HEOC. And what we did was during COVID, when we had all this response going on with COVID, all the vaccinations, and then forest fires and flooding, we actually had two distinct separate org charts. We had one for the forest fires and flooding. We had one for COVID. And our COVID one is still active, and our forest fire HEOCs have shrunk down to just a couple people. So this is not new to most people on this call. So the difference between a lot of other counties and what Gila County did was we decided very early on, we're going to use this ICS system, and we're going to bring everybody into this. We have practiced for the last 10 years for some responses and vaccination clinics. So we had a lot of people on our staff who are very familiar with this, and we stuck with this system the entire way through. And that was a decision we made at the very beginning. And our biggest decision that we made in Gila County was right at the time we had the bushfire in June of 2020 hit, and we had double-digit positive COVID cases in Gila County. And I had to split off all of our resources, and I really didn't know where we were going to get people to help us with the COVID response. The state health department came to the rescue. They notified all counties that there is this CDC funding available for COVID contact tracing and other activities. And Gila County was given $1.6 million of this funding. And what I did was we couldn't really find people very quickly to get them hired and trained in time for us to move into the mass vaccination clinics. So I turned around and hired a company to provide us with all of the incident command resources and contact tracing and organizing of the mass vaccination clinics. So that, I think, was the single most important decision that my team and I made during the whole COVID and forest fire response was actually hiring a company who provided us with the resources and did all the work with our staff to set these things up. So I was very pleased to see that worked out very well. And you talk about, and I just mentioned very briefly that we couldn't find people in time to hire and train very quickly. And one of the reasons why is COVID, as it expanded, contact tracing expanded, so did our org chart. And I have a copy of our org chart before COVID hit. And then the very next slide is going to show you the org chart that we have today. So, and I'm going to go to that. So we went from about 40 employees to over 60 employees in about 18 months. And so it's difficult in some of the rural areas to find qualified people for some of these positions, but it is extremely difficult to find 10 to 20 qualified applicants to hire. So that's one of the reasons why we chose to go ahead and contract it out, is we had to expand our org chart to include many new employees, and we just didn't have the applicants at that time. So that's an incredible increase, 30% increase of our structure here. And you see here, right here, off to the left side under FAP, we only had 2 people before COVID, and now we have, we have 1, 2, 3, 4, 5, 6, 7, 8, 9 people. So we've expanded greatly due to COVID. So, and then what I'd like to do is just throw this next slide up there. Everyone has seen this. If you haven't seen this, I really didn't pay much attention to this particular graphic. Really, I have seen it for the last 20 years. I just didn't pay much attention to it till COVID hit. And if you helped on your COVID response and you look at this, right in the middle of this chart is the public health agencies and everything else around it, I guarantee you that you had contact with every dot on this chart during your COVID response. We were in contact with every type of community, organization, company, government agency, state agency, federal agencies, schools, EMS, hospitals, you name it, everything on here, we had direct contact with on a regular basis. So this graphic actually has certainly a deeper meaning for me as we went through our COVID response with my staff. I would send our staff out to meet with these organizations, phone calls, Zoom, face-to-face, in masks, you name it. We had everybody that came to us that we had to give information out to. So I guarantee you this, that this graphic has much deeper meaning now to me than it ever has. And if you were part of the COVID response for your county, you could, I'm sure you're quite familiar with some of these things. And then what I'd like to do is go into the main part of my presentation right now. And I call this the ODriscoll's Fun Times with Four-Letter Word Association for Pandemics, Fires, and Floods. There is only one object to this game. It's not the catchiest of titles, but I'm hoping you'll play along with me, even though we're over Zoom. I just put out a four-letter word and let you know what it meant to me and my staff over the past 24 months and see if it holds any meaning to you. And I broke this up into four-letter words I like and four-letter words I dislike. And I hope you'll get a few chuckles along the way. And I hope what you'll see is you'll see that a lot of these words, a lot of what we went through in Gila County, all of you went through during this pandemic, and you'll feel familiar with some of those words. Then the next logical question is how did I get this idea to do a presentation based on four-letter words? I will tell you this, since January of 2020, when COVID was discovered in the US, my staff had consistently told me that the four-letter words that they heard uttered from my lips were very creative and colorful. And I'm sure many of those words were uttered by you as well, if you were part of the COVID response. So in March, when 2020, when Governor Ducey declared a public health emergency and then began to release a slew of executive orders, limiting the operations of certain businesses to slow the spread of COVID, I'm telling you, those four-letter words of mine, they were plenty and loud. And my staff was, I'm sure they felt a little humor in that, because I did not hold back sometimes. And if you're wondering whether I've eventually stopped uttering certain four-letter words until COVID goes away and the forest fires and flooding stop, yeah, I don't think I have. So, and my staff still makes fun of me today for that. So here we are 18 months later with the pandemic. It's part of our everyday life now. People are not as stressed as they were, a year ago. And we've had forest fires that have decimated much of the greenery around southern Gila County. Floods have destroyed or damaged hundreds of private properties and homes. Those four-letter words are still coming out of my mouth, which leads me to this presentation for the best and worst four-letter words that describes what roles and activities Gila County Environmental Health played in all this craziness. And this all led to our team becoming the first county in the country to move into general population for vaccines, and while helping our residents through fires and floods and everything else like that. So I'm very proud of my staff, and I'm extremely proud to let you know what our staff did in this next 10-15 minutes to help us out. So what I'd like to do is go over these words one by one. And the first one is fast. So this word, things changed during the pandemic very fast in a matter of seconds. 1 minute we were going down one path, the next minute we'd get a new executive order putting us down another path. And then the fires happened, and then we had to evacuate communities. So everything happened so quickly and so fast that there were times we were working 24/7, that my staff were completely exhausted. So I dislike this word simply because things kept coming at us too fast. Sometimes it felt like we weren't even given a chance to, take in what was happening and make decisions without being exhausted. So this is not one of my favorite words. Once the flood occurs, our team, they were called upon to go out to the affected food facilities, because some of these food facilities actually were flooded out. So they had to go on the weekends, they had to go at nighttime, they had to go in the mornings to help these people get their facilities clean and sanitized, and the food safe, and the power on, and everything else. So our team did an extremely quick job with that. And as well as when the flood occurs, we also have some environmental issues, such as private wells. Were the wells contaminated? Were the wells, safe? Were the well caps on safely? Wastewater systems. We had several wastewater systems that the floods broke right through. And so some of the sewage was going right into some of the drainage areas. So we also had to worry about that. So no matter what I asked of our team, whether to go out to some of these licensed facilities to let them know some of the executive orders, or go out to look at the environmental damages, my small team, they all stepped up and helped us out a great deal. The next word is data. I hate this word because I don't know what data was right and wrong throughout the whole COVID pandemic, because if you go on Google, you could find data for anything. And the data today was not the same as tomorrow. And so we had to struggle with how do we communicate to the residents? How do we communicate to the business owners that their lives are being affected by this particular set of data that we say today, and then tomorrow it changes? So our staff were extremely stressed by going out into the field, trying to tell people, well, listen, the positivity rate is this in Gila County, and the governor's executive order says if it's a positivity rate of this, you can only have half the people in your facility, or if it is this, you have to close your bar, those kinds of things. So that data kept changing. So I do not like this word. It posed quite a struggle for our staff. We overcame it. We did some things on social media to help out with this, but still the data kept changing all the time, which posed quite a few issues for us. Mask is the next one. I don't know if I really need to explain this one. During the pandemic, masks were everywhere. We couldn't find masks at first. When we started finding masks, what masks work, which doesn't, the data shows this mask works, that doesn't, N95 this, So it was, the data on masks was also changing quite frequently, and there was not a lot of research on this. So you ask somebody today and they believe that a simple cloth around their face works just as fine as an N95. So this is a very difficult concept to get across to the residents, which masks are better. So I really didn't like this word either. Time is the next one. We had very little time to handle all of this. COVID came at us very quickly. The vaccinations came at us very quickly. The fires, the flooding, it all came at us very quickly. And emotionally, it just drains the staff. And we did not have enough time to recover from some of the trauma that we were putting our staff into. So that's a concern of mine now, and I wonder if it is on your end as far as when things have slowed down now. Is your staff mentally prepared to handle the change of pace again to pre-COVID times or the new COVID times we're in? So that's a concern of mine. My staff, they were on call 24/7 to help out with anything. So I wish we had more time, but we didn't. The next word is edit. You may think this is an odd word to put on there, but I will tell you this. I put edit on there because it seemed like, here's the process, how it worked. The governor would go to a press conference and would give out executive orders at the press conference. We would listen to the press conference, get a copy of the executive order after the press conference, and actually have to sit down with the staff to try and figure out what does the new executive order mean. And what that meant was we had to go ahead and write press release after press release after press release, and we had to have editors. We had to edit this, we had to edit that, we had to edit anything we were being put out, because social media, if we put out something that had just one little tiny spelling error, oh my goodness, we would have residents claiming that we're the most unprofessional people out there because we forgot a comma or we forgot an apostrophe somewhere. So this really put a lot of stress on my staff to get some of these press releases that we had to release out to the public, looking professionally, and put them through several layers of editing. And even then, you could put it through several layers of editing, but if everybody is stressed and exhausted, you're still going to miss some things. So I don't like this word simply because of all the editing we had to do. The next word I don't like is quit. I don't like this because even during COVID and the fires and everything else, I personally thought about just quitting several times. And I know a lot of my staff felt that way too. So we had to have quite a few conversations with staff about, taking time off. Don't worry about this, don't worry about that. We'll cover here, we'll cover there. So we had this teamwork going, and with our staff, they were covering for each other. So a lot of the activity during forest fires was down in the south. So we had our sanitarian up in the northern area help out the sanitarian down in the southern area, and things like that. So it was a great sense of teamwork. But I included this word on this list simply because during COVID and all this other stuff, many of my staff, including myself, were just like, man, we just got to throw in the towel. It's just not stopping here. So I'm happy none of my team quit. Things are slowing down a little bit, and I'm super happy that none of them have put in their 2-week notice. The next word, I'm pretty sure you'll figure out why I put it in here. That's right, that's the word hell. Because many times if there is a hell, we were in it, is what many of us thought. We went right from going into the pandemic to the bushfire to providing vaccinations to the telegraph fire, the mescal fire, and then the third wave of COVID. And it just was not a situation that I really wanted to put my staff through, but I had to rely on them. And they came through time and time again. I don't know how they did it. I am so proud of them. But it was a very difficult time. And if you agree, I'm sure this word is on your list as well. This next word, news. This was the first pandemic I thought that was done through Google. I mean, people knew more about COVID than my staff a lot of times because they were going on Google and they were finding some of these things out before we were. People were finding out about some of the executive orders before we were. So a lot of times the news, you would do an interview and they would print exactly the opposite. So that was a difficult time. And that goes hand in hand with the next word is called hoax. There are people out there, even in Gila County, who still believe COVID's a hoax. Can't convince them, but they did their best during the pandemic to try and convince as many people not to get the vaccine because they felt it was a hoax. So I included that on this list. And then the next word is fact. What's a fact? What's not a fact? What research is true? What research is untrue? It's one of those things that during COVID and even now, 50% of the people believe this, the other 50 believe this. So what's fact, what's not? We were asked during COVID to sort of figure out what's fact and what's not, and make that decision very quickly and implement some vaccinations and those kinds of things based on the facts and data that we were given. So everybody seemed to have their own opinion on what's fact and what's not. And it made it very difficult for us to talk to some residents who had their own facts in mind. And once you point out what their facts might not be, they would get very defensive and then cause some issues for us, including security issues. We had to get a lot of security at some of these mass vaccination clinics because some of the threats that were made to some of our staff. The next word is called well. These were private wells. So when the fires and floods hit, we had a whole bunch of private wells that were damaged and possibly contaminated water supply. So we had to work with local contractors to go out there and fix the wellheads, secure them, and then test some of the water to make sure that there is no coliform in there. So the state lab was extremely helpful in testing the water for us. The next word is burn. I'm sure you'll understand why, because everything in Gila County seemed to burn over the last several years. So every fire season, I keep my fingers crossed. In the last several years, we've just been hit with fire after fire. Fend. We had to fend business owners off. We had to fend residents off. We had to, we had to fend everybody off. Everybody wanted something from us. I had to send my people out to these licensed facilities, and they had to fend off the business owners to try and work something out with some of these executive orders, how they can stay open or if they had to close. So I included that. The next word is dumb. I only included this on there simply because a lot of the on-site wastewater systems were damaged during the flooding and fires. And I didn't think it was appropriate to use the S word, but I think you get the message. The next word on here is code. I included this because of the executive orders. We were sending our E8 staff out saying, here's a new executive order. And then 2 days later, it would change to a new executive order. So we went ahead. And then it was the executive order said, here's the state code you have to use to close a business or force them to do what the executive order says. And then on the other hand, we had our law enforcement and judges and county attorneys telling us, well, that's not the right code that the governor's office used to get this done. So we had this whole legal issue going on through the entire COVID, and it's still going on. And so we actually had to make that part of our equation. Our EH people had to go out there and try to convince these business owners to go ahead and follow the executive orders without us closing them down. We have not closed down one facility in Gila County for COVID. So we tried to educate, and our EH staff did a wonderful job. Fear, everybody was afraid of COVID. Everybody's afraid of the fires. There was a mass evacuations and people are wondering where their next meal's coming from. There was a lot of fear going on, and my EH staff did a great job in help ease those fears. Soil, I included soil on here because when the fire comes through, it caramelizes the soil and a monsoon sits on top of that and the water comes right off the mountain down the hill into these homes. So I did not like the fact that much of the soil in the mountains surrounding Gila County is now caramelized, hydrophobic they call it. And we're gonna have flooding in the next several years as well. Temperature, I included temp. I never thought I'd have to actually have my EH people go out to restaurants and teach them how to take temperatures of all of their staff before allowing them into work. But that's what we had to do. Cash is another word I don't like because we got a ton of cash. Gila County's received over $8 million cash from the federal government and the state health department for COVID response. The reason why I included, you would think cash would be a good word. I included cash on this list simply because you can throw all the cash you want at us, Spending it is a different thing. We have a lot of money that we haven't been able to spend because we haven't been able to hire people to do some of these things, as well as we have to worry about audits afterwards. And I do not like the audits, because the audits on some of the federal monies that we received are extremely lengthy. So you can get all the cash you want, but monitoring it and making sure you pass the audit is something you have to be very concerned about. Read. We're reading everything. And I'm going to go a little fast here because I know the time's running out. We were reading everything. This next word, I'm sure you'll agree with me. We all ran into a bunch of jerks out there on social media. They were giving us their comments. They were telling us how bad we were. We were taking away the livelihood of people. So we ran into those people. With my staff, they were extremely gracious with these people because we all knew that they were, again, fearful of their business, of their livelihoods. They were fearful of the virus and some of the damage it can cause. So my staff was very compassionate. We're on Zoom, but I did not like Zoom during COVID because everything went to Zoom. Took out the social interaction, and EH people, they meet with people face to face on their properties and their licensed facilities. So Zoom sort of took that relationship building face to face time away, and that posed some problems for us as well. X-ray, we had to teach our staff how to look at X-rays. COVID can do this to your lungs. This is what it looks like. So I never thought I'd have to teach our regular staff how to look at X-rays, but we did that as well. Blogs is the next word. I don't like blogs. We cut off all comments on our Facebook page simply because people were vicious to our staff. And I made that decision about 4 or 5 months ago to just stop all the comments and just put out the information. And but for a while there, we were putting out that information, and people were blogging their likes or dislikes for the health department every day. Meet is the next word. We had to meet the executive orders, and I'm just going to leave it at that because there was a lot of executive orders. And then the last word for the words that I do not like is called defy. So we had in Gila County probably about 40% of all the residents who were defying the recommendations, vaccinations, those kinds of things. So, and they were not silent on this. They wanted to defy everything, and they let us know about it. So that became stressful for my EH staff. And then I'm going to go into really quick, and then I'll take questions. I'll go into the 4-letter words I discovered I liked the most, because there were some. The first word is seek. You know, we had to seek for the right answers. And I include this in there because when you're seeking the right answers to do the right thing, you really have some open and honest communication between your staff. And I really enjoyed that my staff felt comfortable to tell me their thoughts and ideas, and we would implement all of those. So they were seeking the right thing to do. They were seeking it from their heart to help the residents, to help the licensed businesses, all those things. They were not out there to do damage to people. They were out there trying to help people stay healthy and out of the hospital. And but we had to seek the right thing to do, which led to a lot of open communication. We had to allow our staff to vent. This is a word I like the most. I'm famous for telling my staff, if you think you know better than your boss, I used to feel that same way. But go out to lunch, vent with your friends, vent with other coworkers, but leave it at that restaurant and come back. So we all needed time to vent. And I allowed my staff to vent to me, to other staff members, as long as they did it productively. So I like this word simply because I think people need to vent during stressful situations. And if you take it personally, then it becomes a problem. But my EH staff were venting on a regular basis, but in a productive way. They had really good ideas. They were working hard. And they stepped in and did the right thing most of the time, and I can't complain at all. So allowing them to vent is the least I can do. The next word is idea. Like I mentioned earlier, everybody in my team had these ideas, and the EH staff, I asked them to go out to these facilities, try to get the business owners to follow the executive orders while they were being threatened, go on private property after the flooding to help them clean up their property. The environmental sanitarians sort of, you throw them into this pot and you mix it up, and they're trained to basically do a lot of different things. So I called on my EH staff to do a lot of things, and they had a lot of ideas, and their ideas were great. And I'm convinced that many of their ideas led us to be the first county to move to general population vaccination. So, I can only stress, if you're in management in environmental health, that brainstorming sessions and honest idea sessions with staff couldn't hurt, especially in stressful situations. We worked as a team. That's the next word. I love it. We couldn't have done this unless we did work as a team. We built very strong relationships, personal relationships with all of our team members, because you're under stress. You're under political stress. You're under public stress. What I observed of the team is we had certain employees stick up on social media for other employees. So when they were getting attacked, other employees stepped in. So I was really pleased that we had a strong sense of teamwork throughout this whole thing. We had to rely on our peers. I relied on all the other health officers and what they were going through. They were telling me what their environmental health departments were doing. I would call other sanitarians. What are you doing there? Rely on our environmental engineer and our sanitarians for certain things. So we built this stronger relationship with our peers around the state too, which I thoroughly enjoyed. The next word is talk. We talked to everyone in the community. Remember that graphic with all the dots and the strings going and connecting in the community? We talked to everybody. We talked to politicians. We talked to mayors. We talked to elected officials. We talked to residents. We talked to anybody. And my team was so open to talk to anybody that I really believe that their openness and willing to be responsive and call people back in a timely manner really helped us through this whole last 2 years. The next word is hope. My team never lost hope. I kept asking my EH team to go out, help with pandemic, help with the vaccinations, help with the fires, help with the flooding, and they never lost hope. And we all knew it was going to come to an end at some point in time. It slowed down considerably, but it's not ended, obviously. But my team never lost hope. And it wasn't by any of my doing, it was them. It was, they would talk to each other and they would provide support for each other. The next word is free. Nothing is free, but I included this on there simply because we received a lot of money, free money, I call it, even though it's taxpayer money, but we received this free money, which really helped us out. And I will deal with the audits at a later time. I'll deal with all the documentation, but that money we received, and even some donations from our partners, from the mining companies, the PPE donations, all of that stuff that people were donating for free, really helped the residents of Gila County out more than I think they know. Goal is the next one. You always have to have goals as a team. And in this case, we always talked about the goal of just doing our best and making sure that anybody who wants a vaccine can get a vaccine. And we reached that goal and again, became the first county in the country to move into general population. So I think I'm very proud of my team for exceeding the goal. We just wanted to do a great job, but they did a fantastic job. The next word is luck. You always need a little bit of luck. And we received a lot of luck. We received last minute funding by the state of Arizona legislators and the governor, post-fire flooding funding to the tune of $36 million that we're able to tap into for our residents to clean up their property. So it was just good luck, and timing sometimes helps out in stressful times. And in this case, we received quite a bit of luck. The next word is sane. you have to remain sane even though you want to go insane. That's what I learned, is there are times that I just thought, I can't do it anymore. I'm just going to go insane. And that's where the team comes into play, to keep everybody sane on the right path to meet the goals. So we all worked as a team to keep each other sane. And then the next word is calm. You really have to have moments of calm through the pandemics and everything else. And when you do find moments of calm, you really have to share those moments with your team and your staff to keep everybody calm. Because if everybody is stressed and going in different directions, you'll never meet your goals. Peak, I include this because when the COVID peaks happen, after the first one, we're able, once we see a peak, we're able to predict with our hospitals how many ICU beds they may or may not be using. So once we saw a peak, then we were able to make plans very quickly. And so once the peak happened, it was easier to predict and to put resources in certain ways. So after the second peak, when we went into the third peak, we knew exactly how to handle it. So joke, you have to joke around. Humor is a wonderful stress reliever. And as all the sanitarians on this call will know, if you can't make poop jokes about sewage, then you're not a true sanitarian. So joking around really helps, and my staff had a great sense of humor. You have to ask for help. That's the next word. We ask for help from everybody. We ask for help from the state, from the feds, National Guard, you name it, we ask for help, and we were not shy about it. And I know I only have a few more minutes left, so I'm going to go through the last few really quickly. Kind, you have to be kind and compassionate to people. The year, the year went very quickly, and I included this in here simply because I thought it was humorous that 2 years has gone by and I'm 2 years closer to retirement. So I thought that was a good word to include. Duty, sanitarians are wonderful at understanding their duty and stepping up and sort of trying to figure it out, trying to figure out anything that comes their way. My staff was no different. They did not shy away from their duty, and they went above and beyond. Food was scarce. If you remember, there was food shortages towards the beginning of the pandemic. It was actually worse in the rural areas because a lot of the people who live in the urban areas went to their second homes in the rural areas and then went to the local grocery stores and caused even more of a shortage because people were fearful. So they would just buy food they didn't need just because they thought that food was not going to be there for them in the future. So that caused a huge food shortage in some of the rural areas. You need time to plan. The last two words are plan and heal. You need time to plan. I think we can handle a pandemic in the future. We didn't plan for this large response, but now that we have gone through it, we are already planning for the next response. And then this is important. I included this as the last word simply because we all need time to heal. We need time for staff, my staff, to sort of heal from the PTSD, from the 24/7, from the stressful situations, from the constant, attacks on social media and phone calls and emails and those kinds of things, and really take some time to heal. So I'm really concerned about this in my staff, but we're going to work on that in the near future. So that is all I have for my presentation, and I know it's only a couple minutes, so I'm going to go through a couple of the questions on here. One of the questions is there a way not to just mitigate fires before they start, but to mitigate human exposure during and afterwards? Meaning, is there a practical concern with smoke exposure prevention? How much might the ash or debris represent a human health problem? Smoke during a fire is huge. We work with ADQ. They have air quality monitors. Once we have a fire in the area, ADQ brings out these monitors, and at certain particulate levels, we have to put out press releases warning people to stay inside, especially if they have upper respiratory issues. The particulates from the fire can really cause some problems for those people. So we do work closely with all of the departments in Arizona when a fire happens, and the U.S. Forest Service to make sure that we minimize the impacts of some of the particulates. So yeah, it's a big concern of ours. And over the years, we actually have issued press releases for those with upper respiratory issues to stay inside until the particulate level declines. And we also give out N95 masks to anybody during a fire that really feels that they need to protect themselves from some of the particulates from the fire. So I hope that answers your question. Here's another one. Can you speak of the effects of the fires on wildlife? Well, we had, for the last several years, millions of animals perish during the fires. Some of these, when the fires move quickly, the wildlife gets caught up in that, and there's no escape. So we know there's millions of wildlife that have been killed during the forest fires, which is a tragedy. We really don't know the effects of the wildlife just yet. We are working with the Forest Service. They're doing monitoring of coyotes and other wildlife, which will give them a better assessment as to what has survived the fires and what's not. So there's like 3 or 4 species that are endangered, and in the middle of Gila County, right by Roosevelt Lake, and on top of the Pinals. And guess where those 2 fires hit this past year? On the top of the Pinals and by Roosevelt Lake. So the biologists for the U.S. Forest Service are working closely to figure out what's going on with the wildlife. So, and hopefully it won't be as damning as I thought during the fire, but I'm just keeping my fingers crossed. Remember that word, luck. I'm wishing for luck here. So, and that's about it. So I don't see any other questions here. I really appreciate your time today. And if there's any questions, please email me directly or ADHS, and they'll forward it on to me, and I'll be happy to answer your questions. So thanks again. I appreciate it.